Hi, all. This is Mary Key from the Office of Admissions. I am going to just give it a minute to transition to our next session with Dr. Robert Dubrow on climate change and health at the Yale School of Public Health. So just give me.
Yeah, so welcome everyone. I actually see that a number of you I've corresponded with already about the concentration. We could make this very informal. I know it's difficult on Zoom, especially during a slide presentation, but feel free to just speak up if you have any questions or comments as I'm going through this presentation, and then we'll have time afterward, and I'll stop the slides and for any other questions or discussion as well. So I'm going to describe the School of Public Health's climate change and health concentration. So, okay, there we go. And I'd like to start just by introducing, and for some of you, I know this will be a review, but I think for some of you, maybe not. Why have a climate change and health concentration? What are the issues? So one, of course, is that we're seeing adverse health effects of climate change now, and we expect that, unfortunately, they will get worse in the future. And those adverse health effects are multifaceted, including heat-related illness and death from extreme events, such as tropical cyclones, floods, wildfires, and droughts, food and water insecurity, adverse health effects of climate change-induced air pollution, vector, water, and foodborne infections, mental disorders, including post-traumatic stress disorder and depression, that could result from having experienced extreme events, losing one's home, for example, during a hurricane, also from being a victim of population displacement. And there are other adverse health effects of what I'm calling climate migration or population displacement as well. Okay, and we're also concerned about adverse health effects of human activities that cause climate change. So foremost, that is extraction, refining, and burning of fossil fuels. Of course, the burning of fossil fuels produces toxic air pollutants in addition to generating greenhouse gas emissions. And those toxic air pollutions, such as particulate matter, kill millions of people each year around the world. Industrial animal agriculture is a second human activity that has adverse health effects, as does deforestation. Okay, and we're also concerned very much about justice issues. So essentially, the health of low-income, working class, and racial and ethnic minority communities in the US and indigenous and poor communities in nations around the world is disproportionately harmed, both by human activities that cause climate change. So for example, communities of color in the United States tend to live near polluting facilities, like oil refineries or power plants, and also by climate change itself. And so that's due to vulnerability factors like the physical location of the communities, I kind of mentioned that, and also their lack of access to resources to deal with these issues. Okay, and also there are very difficult policy challenges to with regard to climate change and health. And I'm listing some of the reasons that they're difficult challenges here. I'm sure you're aware of all or most of these. So one is that it's a global problem that requires global solutions. It doesn't matter where in the world greenhouse gases are emitted. Wherever they're emitted, it affects the whole world. Secondly, climate change is unfolding over a timescale of decades to centuries to millennia, although we need to emphasize that it is happening now and already having severe consequences. But to avoid catastrophic climate change, we need rapid and far-reaching transitions in energy, land use, transportation, buildings, and industrial systems over the next decade. And I'm sure you've heard a lot about that already. That comes out of a report of the Intergovernmental Panel on Climate Change that was published in 2018. Third, there's a low level of climate literacy and scientific literacy general, and that's the latest manifestation of that, of course, has been the COVID-19 pandemic in terms of scientific literacy in general. And then finally, the fossil fuel industry, which is the richest and most powerful industry in the history of the world, is really dead set and has been over the past number of decades, dead set against action to address climate change. And that's been a huge impediment to progress and to making rational, sound policy. Okay, so because of all these overriding issues, at Yale, we see climate change to be one of the premier public health problems of the 21st century, if not the most important public health threat of the 21st century. And so we've established over the past 6 years a Center on Climate Change and Health. This is the mission. The Yale Center on Climate Change and Health utilizes research, education, and public health practice to help safeguard the health of human populations from adverse impacts of climate change and from human activities that cause climate change. To protect health, we work with academic, government, and civil society partners to utilize science to contribute towards sharply reducing greenhouse gas emissions and building resilience to the climate change impacts that continue to occur. We aim to make local, national, and international impact and to integrate social justice into all of our work. So that's our mission. I'm the faculty director of the center. And so our mission mentions research, education, and public health practice. Those are the three pillars of the center. And so let me elaborate on each of these briefly. So first, the research. We have what we call a core research program, and that's directed by our Director of Research, Dr. Kai Chen, who's an assistant professor in our Department of Environmental Health Sciences. And that program focuses on a number of research areas. I'll go through them. First, interactive effects on human health of ambient temperature, air pollution, extreme weather events, demographic factors, and social determinants. So all these things really interact and mix together, and you can't really consider climate change alone. You always have to think about climate change in relation to all these other factors. Secondly, modeling future climate change impacts. Third, we're interested in the immediate health benefits of climate change mitigation and adaptation policies. So what that means is that the best example is fossil fuels. When we burn fossil fuels, we reduce CO2 emissions, and the purpose of reducing the CO2 emissions is climate change mitigation. Get at the root of the problem, stop climate change. However, when we reduce or stop burning fossil fuels, we have the immediate health benefit of less toxic air pollution. Because when we burn fossil fuels, we reduce the particulate matter, the ozone precursors, the NO2, et cetera, that are toxic air pollutants. Okay, next, the research looks at effects of mitigation and adaptation policies on reducing health disparities. That gets it back to the justice issue. And then finally, we try to understand and develop adaptation strategies themselves, especially to extreme heat. Okay, next, with regard to research, we have a rather unique program on healthcare environmental sustainability. And that program, so a lot of people are surprised to learn that the healthcare sector itself is a major source of greenhouse gas and other pollution. So for example, in the United States, the healthcare sector is responsible for about 10% of greenhouse gas emissions. And when you think about it, it's not that surprising because it's such a huge industry. So this program on healthcare environmental sustainability works on ways to make the healthcare sector more sustainable by reducing its greenhouse gas emissions and emissions of other toxic substances. And that involves, if you've ever interacted with the healthcare system, you've seen the tremendous amount of waste that's in the system. Everything is single use, for example. And so that involves addressing issues such as that both, and we think there's a triple benefit here. One is that sustainability, decreased costs, such as by reducing waste, and improved patient care all go together. Okay, third, we're a partner in an international collaboration called the Lancet Countdown on Health and Climate Change, which publishes an annual report in the medical journal, The Lancet, about the status of climate change and health, with a focus on 40 some odd indicators that we track each year. The last report was published in December 2020. And finally, I'll mention that we have 34 affiliated faculty with an interest in climate change and health research, and who actually do climate change and health research to a greater or lesser degree. Okay, so now that was the research. Now let me turn to the education. So we have the concentration. I'll talk about that in more detail in a couple of minutes. For those of you who have an interest in climate change and health, but maybe not so much of an interest that you'd want to make the commitment to do the concentration, we have a student associates program. This includes students from all parts of Yale, including the School of Public Health. And we do programming for them. It's largely student-led, but we have programming throughout both semesters. You apply to be a student associate at the beginning of the fall term. And so we have special seminars, for example. Sometimes we watch relevant movies, that sort of thing. We have a mentor network. So the mentors are people who are actually working in the field of climate change and health. And have agreed to serve as mentors to students, especially around kind of career counseling, for students who really want to see climate change and health as your career. And both student associates and student concentration are eligible to be paired up with mentors. Okay, I'll mention briefly our certificate program and our Coursera specialization. Those are specifically for not for Yale students. The certificate program is aimed at working professionals, and the Coursera specialization is really for anyone with an interest in the topic of climate change and health. Okay, and then finally, the public health practice. So given that we're in Connecticut, we feel an obligation to do some work in Connecticut. So we have a program on climate change and health in Connecticut. Its main product so far has been a report called Climate Change and Health in Connecticut 2020 report, which we published last September. If you're interested, you could find it on our website. We have a course called Clinic in Climate Justice, Climate Policy, Law, and Public Health. So this kind of overlaps with education, but this is a public health practice clinic in which student teams carry out practical projects related to the course theme. So to give you one example, this semester we're doing a project, and each of the projects is done with an outside partner. So this semester we're doing a project with an organization called We Act for Environmental Justice, located in New York City. It's obviously an environmental justice organization. And the project is specifically about cooling centers that are sponsored by the city of New York. So cooling centers are public spaces open to the public during extreme heat events. And the purpose, and so We Act is developing an advocacy campaign to make those centers better, essentially. And we're helping them do some background research in order to help that advocacy. Okay, we have we both identify summer internships in climate change and health and have some funding for summer internships, not for all of the ones we identified, but for a subset of those. And finally, each year we sponsor an annual advocacy workshop. This year we did it actually throughout the month of February with smaller weekly events throughout the month. Okay, and then some cross-cutting activities. We do a seminar in climate change and health in which we sponsor 4 seminars each semester. These are either outside speakers or people within Yale who are working in the field. We have a policy impact unit that tries to basically use research that's done in the center as well as public health practice work to develop and advocate for innovative policies. And with regard to communications, we have a website, I already mentioned that, and we have a monthly newsletter that you could sign up for if you're interested in, and we also have a Twitter account. Okay, so now let's turn directly to the concentration, now that you have background. So first, we think the concentration should be of interest to students from all departments in school public health. As a little background to concentrations, if this hasn't been explained to you already, every student, as you know, enters the department and you need to complete that department's requirements. But you're also able, on top of the department, to add on a concentration because the concentrations have fewer requirements than departments do, and it's possible to do both, to meet both your department's requirements and the department's and the requirements of a concentration, such as the climate change health concentration. So we think this is of interest to, obviously, to environmental health sciences students because climate change could be framed as environmental exposure. To epidemiology of microbial diseases students because climate change affects infectious disease transmission in very important ways. Chronic disease epidemiology because climate change affects asthma, respiratory and cardiovascular disease, other chronic diseases. Biostatistics, because a lot of climate change research could involve sophisticated modeling. Social and behavioral sciences, due to the mental health concerns, the social justice concerns, and issues around behavior change. Health policy students, I mentioned the thorny policy issues. There are a lot of really interesting and important policy issues to deal with. And finally, health management students, particularly because of the healthcare sustainability aspect that I mentioned, which is a health management issue. Okay, and I'll mention that despite the need for more education about climate change and health, as far as I know, there are only 4 other climate change and health master level programs. Actually, if any of you know of other programs, I'd be interested to know what they are. I try to keep track of those, but these are the 4 that I know about. And so the concentration, as I mentioned, we have 34 affiliated faculty. It's governed by an executive committee that includes me, Dr. Chen, who I mentioned earlier, and Dr. Sarah Lowe, who's in the Social and Behavioral Sciences Department and does work around mental health. These are the competencies. So if you go through the concentration, you should come out with being able to describe how the climate has changed, explain the role of greenhouse gases in climate change, and describe how the climate is predicted to change in the future. Describe how climate change adversely impacts population health with differing vulnerability across population subgroups. Explain how adaptation and mitigation strategies can reduce adverse health impacts of climate change and can generate substantial non-climate health benefits in a just and equitable manner. Apply basic methods used in climate change and health research. Apply knowledge and skills learned in the classroom to an applied public health research or public health practice project focused on climate change and health. And finally, explain and value the relationship among climate change, public health, and justice. Okay, so this is the curriculum. The required courses are EHS 547, Climate Change and Public Health. That's a foundational course that I teach. EHS 560, Methods in Climate Change and Health Research, taught by Dr. Chen. EPH 555, the clinic that I mentioned, and that's taught by Dr. Laura Bozy, who's our center's director of programs. And then, so those are the 3 required courses. We also require that you take 2 semesters of the seminar, and that's a very easy lift. As I mentioned, there are 4 seminars per semester. They're not for credit, basically, but you know, you either complete it or you don't complete it. And to complete the seminar, you need to attend the seminars. And for each seminar, we have a reading that we ask that you read in advance of the seminar and then submit 1 or 2 questions to be asked to the seminar speaker. So that's, you know, the requirements are pretty light for the seminar. Then we also require that you take 2 electives from a list of, right now it's 24 courses, that could vary from year to year. We review all of the courses offered in the university with regard to whether they would be suitable to be electives for this program. And so we update the list of electives every academic year. And then suggested but not required is that you do a summer internship related to climate change and health, and that your thesis, if you do a thesis, that be related to climate change and health. But that, again, totally optional, not required. And this is a typical timeline. So the foundational course, Climate Change and Public Health, in your 2nd semester, Methods in Climate Change and Health Research in your 3rd semester, the clinic in your 3rd or 4th semester, the seminar, any 2 semesters, you know, you could start that if you know you want to enter the concentration, you could start in your very 1st semester. And then 2 electives in any semesters. Although we do recommend that you take at least 1 elective and at least take the seminar once during your 1st year, so you don't have too many requirements to meet during your 2nd year. Okay. In terms of admissions to the concentration, it's in the fall semester. The application deadline is November 1st. It's a simple application process, just some basic information, your CV, transcript, and a short essay. And then you'll be notified roughly 2 weeks later. So that's my slide presentation. And so now I'll open it up to any questions, comments, discussion.
I have a question, Dr. Dubrow. It's good to see you again, and thank you for hosting this session. You mentioned that there's only 4 other climate change and health programs, and I think I'm comparing this specifically to Columbia, but I know that theirs is set up as a certificate, and I think it's like recognized by the state of New York. So I'm just wondering how that differs to a concentration, or whether there is really any difference.
Yeah, first of all, hi Danielle, it's nice, not that I don't exactly see you, but nice to hear from you. And there you are, okay. So my understanding is that it's just a difference in terminology. Mary, do you know if on the transcript, is it indicated that a student completed the concentration? I believe so.
Yes, it is. And I think, Rob, if I'm not mistaken, I think that, you know, it is a difference just in the name. And we, you know, a concentration is accredited by CEF, the Council on Education for Public Health, for us. It is the sort of the difference between our tracks right now and our concentrations. So I think when they say that it's approved in New York, I think that's what they're referring to. But it will be listed on your transcript, yes. And I'm not sure if we will be giving out an actual sort of certificate at commencement along with your Yale diploma. I don't know if that's going to happen. Everything's so in flux due to COVID in terms of, we're even mailing them this year, but that could be coming too.
Yeah, so just to elaborate a bit on that, when we established the concentration, when we were planning it, we're required to submit a plan to our accreditation body, which is the Council on Education for Public Health, or CEF. And they gave us some comments, and then we did some minor revisions. We submitted it again, and we received formal approval. So it is accredited in that way.
Okay, sounds good. Thank you.
Sure. Any other comments, questions?
Yeah, I have a question. Hi, I'm Rebecca. Nice to meet you.
Hi.
I have been also admitted to YSE, and I'm hoping to do a dual degree with the MEM there, focused on climate change and solutions. I'm wondering if you could talk a little bit about if it's still feasible to do the concentration and sort of what connections there are between the two schools.
Yeah, great question. So also, that's a great program. The Yale School of Environment it's a really good school. So congratulations. And
Thank you.
I think doing the joint program, you'll really get a lot out of that. And there's a student actually who was another student who was admitted this year. She's a first-year student right now at the School of the Environment, but was admitted into the School of Public Health. So she's going to be doing the joint degree, and she's very interested in climate change. So I've had discussions with her, and we figured out that it's very feasible to be in that joint program and to do the concentration. The reason being, first of all, you could use 2 of the electives could count for both your Yale School of the Environment and for the concentration electives. We have a lot of electives. A lot of the courses on the elective list are offered by the School of the Environment. So that's one big reason. And then, for example, if you took, you would have to take the Climate Change and Public Health course, which is one of the required courses. And I'm sure, virtually certain, that you could use that also for your Yale School of the Environment credits. So by combining things and double dipping, it is possible to do that.
Great, thank you.
Sure. Okay, anything else? Okay.
Yes, I have a question as well.
Oh, sure.
Hi, my name is Timothy. Very nice to meet you. And hi,
Nice to
Mary.
meet you.
I know we spoke a little bit.
Great to
could-
see you. Thank you for joining us.
Of course. Could you discuss more about like career outcomes with the concentration? And I know also the website mentions there's a huge demand for this type of career. Could you just discuss that in more detail?
Yeah, sure. So we don't have experience. First of all, it's a new concentration. So I can tell you, our graduates have done, have gotten these and these and these jobs. But especially now, you can't predict the future, but at least for the next 4 years with the Biden administration, there's going to be a lot of emphasis on climate change, and there's going to be a lot more resources going into it. And there's a real gap right now at the state and municipal level in funding of adaptation. So I didn't explain, if some of you may not know the terminology. Adaptation takes the viewpoint that climate change is happening, it's having adverse health effects. What are we going to do to reduce those effects? So it's not, as opposed to reducing greenhouse gas emissions, which is getting at the root of the problem, adaptation is trying to say, how are we going to protect ourselves from the climate change that is happening? And so that's something that's taken up by, or should be taken up, and is taken up, but not enough, by both state and local health departments. And so that's one place where I would see growth and need for people who are educated in this field. So what I could point to is, I mentioned our certificate program, where we educate working professionals, not Yale students. And a lot of the people who go through that program, you know, the reason we started offering it is because there has been no education for the most part about climate change and health. And there are workers out in the field who feel that they really need that. And we found that we were right, because we're offering the certificate program now for the 6th time. And each time, you know, we've been able to fill it. We educated about 80 to 90 students each round. And we get physicians, nurses, advocates, but we also get, you know, a fair number of people who work in health departments at various levels. I'll say one more thing and then stop, because I mentioned advocates. You know, I think there's more advocacy is recognizing more and more the importance of bringing health into the climate change conversation. So organizations like the Natural Resources Defense Council or Environmental Defense Fund, Sierra Club, you know, so they're taking up the health angle more and more, which means that they'll need people who actually understand and are educated in it. So those are a few things I could say. And then there's the mentor, you know, then you'd have the benefit. I mentioned the mentor network. So, you know, if you were interested, you'd be assigned, you'd be paired with a mentor who could also help you think through the career goals.
And if I could just jump in here a little bit and make a pitch for our career management team and our alumni networks. You know, we have had students in the past that we didn't have a formal connection to climate change, but they came out of our environmental health sciences area. And also, I think the sort of where people end up career-wise may depend a little bit on their, you know, department, as Rob referred to earlier. So there's epidemiologists, you know, may be coming at climate change in a different way than the policy people. And so that may impact where you go to work on this. But I think with the growing focus on the implications of this in careers, you know, we've seen people in the past go into, I'm thinking about GE a few years back hired one of our EHS graduates, and you can just imagine sort of the impact of them as a corporate citizen. But certainly governmental agencies are huge, you know, and just the EPA, of course. I don't need to you know, clarify that, the CDC, even in the NIH. But you know, we have seen a big increase of some of our students from the policy area, but across the departments going into sort of governmental work more at the, you know, as Rob referred to, sort of the state and national level, being policy advisors or climate change advisors, say, to people in positions of power or other kinds of organizations. So I think it's really wide open. I think it's going to change over time, and I think the opportunities will be tremendous for you. But career services or career management, whatever you want to call, is a great partner in helping you figure all this out as well.
Yes, thank you very much. Yeah, I know with Joe Biden, it's definitely going to be a huge field. I just wanted to understand your perspective on it. So thank you for the additional details. It was very helpful.
Good. Yeah. Nice to meet you, Tim.
Nice to meet you as well.
Yeah. So anyone else? This is your chance if you have any questions.
Sorry, I have one more question.
Okay.
Could you just give some examples of some student projects from the clinic that you mentioned?
Sure. So yeah, so I mentioned the WEAC project. So a couple of years ago, I'll just think of random projects. No, actually, I'll tell you about one that we're doing now in general terms. This is, I had mentioned in the little talk that I gave about industrial agriculture as being, you know, both a source of greenhouse gases as well as a health hazard to the surrounding community, essentially. So there are a lot of problems with industrial agriculture. So we actually have a project being done in partnership with Public Citizen. Yeah, I think that's their name. They're working in California around industrial dairy farms. And in general terms, without going, it's actually fairly complicated, but the idea is that the farms are converting cow manure to methane. And, so methane is burned, as a fuel. And so that it's the same as natural gas for those who aren't familiar with this. Natural gas is methane. And they're calling it renewable natural gas. And so, but the surrounding community feels that it's being used to entrench the industrial farms, whereas they would like to see a fundamental change. And also that it's being used to kind of entrench natural gas, where we have to phase out natural gas if we're gonna have any chance of dealing with climate change. So anyway, the project, so they're helping this organization, Public Citizen, around background research for them to be dealing with this issue. And they're also working with some community groups as well that are located near these industrial dairy farms. So that's one example. I'll give one other example. Connecticut has a process, has an entity called the Governor's Council on Climate Change. And it's a group that the governor established to make recommendations about how Connecticut could meet its climate change goals, which, to be honest, could be more aggressive than they are, but they're not terrible either. And so in any event, one of our student groups last semester and this semester has been working with this Governor's Council on both some background research and also on conducting both interviews and focus groups in order to enhance public participation in the process. So to get input through the focus groups, for example. So those are a couple of examples.
Okay, so not all the projects have to be in Connecticut, but they could be?
They could, yeah. They may or may not be in Connecticut. So another one we're doing now is actually in northern project in Vermont around rural transportation and how to make that more climate friendly. So we've done projects in Alabama. In the pre-COVID era, we've had some traveling during spring break. So Yale has a 2-week spring break. And so we've had teams travel down to Alabama and do work directly with communities during those, during the spring break. But unfortunately, this academic year, there's been no traveling, or last spring, yeah.
Sounds good, thank you. Sure.
Any other, Matthew, it looks like you might be getting ready to talk.
Yes, correct. Thanks again for hosting this meeting. I had a question about the Yale Center on Climate Change. And I'm wondering what opportunities MPH students often have to participate in research. And I'm also wondering what projects are happening right now that you're particularly interested in.
Mm-hmm. Sure. Nice to meet you, Matt. So a couple of things. We have right now, and the numbers could change. I'll just tell you what we have now. We have 2 research student, no, we have more than 2. We have 4 student research assistants who are working on various projects. We actually have 2 who are working with Dr. Jody Sherman, who heads the Healthcare Environmental Sustainability Program that I mentioned, on her work. And we have 2 others who are working with Dr. Laura Bosey, who I mentioned, who's our Director of Programs. And she actually also heads up the Connecticut work. And so as a follow-up, I mentioned our report on climate change and health in Connecticut. And as a follow-up for that, we're developing issue briefs on specific, more specific issues within Connecticut that we're targeting towards the state legislature, especially. And so they've been helping with those issue briefs. The first one, if you're interested, is posted on our website. And it was an issue brief about some, basically advocating for some programs and legislation around dealing with heat issues. So that's one avenue is student research assistants. And so those are paid positions. And then also there's this summer, to work with us in the summer. I mentioned the summer internships. Most of those are external, but we also have, for example, we have an internship with We Act for Environmental Justice. That's an example of an external internship. Some of them are partnerships with external organizations. So with that particular internship, I'm going to be working with our We Act partner to help to supervise that intern. Others are just basically we're helping students and the external organizations by matching them, but we don't really participate. And then thirdly, the third option is that we have this year, I think, one internship in the summer that's just going to be someone who's working at the center, a student who's working with us at the center on center-related research. And again, it will be focused on our Connecticut work. But it doesn't have to be, this is kind of what's happening right now, but there's evolution involved. So, there's potential to have students working on other areas as well.
That sounds great. Thank you so much.
Sure thing. All right, anything else? Maybe we're done. Okay, last chance. Any other questions, comments, concerns? Okay, so if you didn't notice, I put in the chat a one-pager about the concentration. Everything, it doesn't add any new information, but it kind of summarizes, basically what I said about the concentration. So if you're interested in that, it's there. Mary, do you post these the slides or?
Yes, this is going to be, it may take a day, but they are going to be posted on our website. So you can refer back to this, and certainly you can be in touch with me or Becca for any assistance with any of this as well. Thank you, Rob. You've been great.
As well. Right. I'll send you the slides, and also I'll remind you the link, if you're interested, if you want to sign up for our newsletter, whether or not you join the concentration or whether or not you come to Yale, feel free to sign up for our monthly newsletter. The link is in the slides, and I hope you come to Yale. But I'm glad to see that there's so much potential interest in the concentration. And thanks very much for spending the time on this.
Thanks, Rob. Thank you, everyone. Look forward to seeing you on our upcoming other virtual open house events. This has been terrific. Bye now.
Okay, bye.